Can hypnosis help folks with addiction or addictive behaviors? Stick around and let's find out. Live, trance, and prosper. Hi, I'm Dr. David Phillips, and this week's Tips, Tricks, and Questions has a question. And our question this week is regarding addiction and addictive behaviors, or addiction-like behaviors, compulsions or slight compulsions, if you will. This week's question comes from Anonymous Annie. That's what I'm calling her, Anonymous Annie, mainly because she's going to be anonymous. We'll just let the actual person deal with her own identity. Let's protect that for now. But let's look at the question that Anonymous Annie asks us. Hi, Brian. Hi, Annie. How are things with you and the family? I know you are an expert when it comes to hypnotism, so I thought you might be able to help. Do you have any videos or experience with hypnosis for addictions or addictive behaviors? Anonymous Annie. Well, Annie, hi back to you. My family's fine. Actually, at this moment, my daughter is in the air flying home for the holiday, for the winter break, or summer break, since she goes to Australia. It's her Christmas break. Alrighty, but as to the crux of your question, no, I don't have any videos or audio programs specifically designed for addiction or addictive behaviors. Now, there's a reason for that. When folks approach me with issues related to addiction, I ask them, what sort of addiction are we talking about? It's important to distinguish between substance abuse and behavioral addictions, as well as clinically diagnosed addictions. If someone has a substance abuse problem or an addiction to, say, alcohol or drugs, I refer them to a licensed counselor who specializes in addiction, either alcohol and dependency issues or something else. Now, there's a reason for that. In some places, legally, the scope of practice of a lay hypnotist, that means a non-licensed medical or mental health practitioner who performs hypnotherapy. It doesn't mean they're not qualified, they are. But in many places, a person who practices hypnosis must either be a licensed medical practitioner or licensed counselor or psychology professional to deal with clinically diagnosed addictions or addictive behavior. Now, where I live, that's not actually part of my scope of practice, in that I don't have to refer folks, but I do. And I do for a number of reasons. I've trained extensively in hypnosis and in hypnotherapy, and I've helped a lot of folks. But I'm more comfortable with things like medical issues and psychological issues that are clinically diagnosed, working as a referral from a medical or psychiatric or psychology or counseling professional who's licensed. That's just within my comfort zone. It's also, I know that someone who specializes in addictive counseling, they have a lot more training than I do in that respect. Don't get me wrong, hypnosis can help a lot, and I've helped a lot of folks, but I prefer for that kind of work to be one-on-one with a referral. Now, if you're in a place where you don't have to have a referral, that's fine. I would strongly encourage you, rather than watch a video or listen to an audio recording for substance abuse issues, that you work with a qualified, competent hypnotherapist face-to-face. Because really, There's just so many things that regarding addiction that could be the underlying cause, that a simple recording of direct suggestion is probably not going to be as effective. Don't get me wrong there either. It can be very effective for some people. So the recordings can work for some people. I just am more comfortable referring folks to face-to-face direct therapy for these issues. That would also, now that's for substance abuse issues and addiction to alcohol or drugs or something like that. When we look at compulsive behaviors or like addiction to gambling, addiction to porn, addiction to gaming, those are things that are well within the wheelhouse of a hypnotherapist. Once again, I probably wouldn't recommend just listening to a recording. I'd say go talk to a competent, experienced hypnotherapist, someone who's been around the block a few times. Now, having said that, yes, there are some things that can be helpful on my website related to those issues. I would start with training one to respond to hypnosis. An excellent piece for that would be something along the lines of my recording on the Ultra Trance. That's a long piece, I know. Listen to it about 3 times a week for a couple weeks and really train yourself to respond to it. It's a long piece, but you go nice and deep, and it has something for everyone. Once you've trained yourself to respond to trance, then of course move on to a number of other recordings I have. I've got a very simple reframing piece, parts reframe recording on my website that works for a lot of folks. Actually, many of my recordings include the same pattern as a tack-on to whatever the recording is about. However, this is just on its own. It's a standalone piece for reframing or for dealing with things. It's based on what's called the 6-step reframe, and I have a webinar on the reframe you can check out, which is very helpful for folks. It teaches you the background for it and then how to do it for dealing with that. And the reframe is actually, it's based upon what's called the parts process, and the hypnotherapist who knows what they're doing can do wonders with what's called parts therapy, which is a fine process. Another process you could consider for simple behavior changes is something along the lines of the swish. Now, there's a webinar on my site you can listen to if you're a member, or just purchase for a download, that can also be incredibly helpful. Now, there's lots of things that a therapist, a trained person, could do with a person with addictive behavior issues. For instance, the parts and the reframe, hypnoanalysis, which is regression therapy. I would only go to someone who's competently trained in that if that's an avenue for therapy. But then again, don't choose what modality you want. Just go to someone who's competent and experienced, and they can help you out. They can do things like 3D Mind, which a lot of hypnotists don't know how to do, and I strongly do encourage them to check it out. That's Tom Vincini's process, and he teaches that. Other things you can look at are, what else? Interrupting. I've seen folks do some amazing things with behavioral pattern interrupts, which can do wonders. But in terms of addictive behavior, I don't have anything specific on my site, and now you know why. However, I do strongly encourage you, if you're dealing with addiction or someone you love is dealing with it, that you recognize you have the issue first. Obviously, you're asking a question, so I don't know if it's because someone you love has problems or if you are having issues. If you're having issues and you recognize that, you're already well on your way. And then go to someone who is competent and qualified in that. I hope this has been helpful on Wednesdays, we answer questions with tips, tricks, and things like that. Those of you watching, if you have a question, just comment or email me or message me and ask. Maybe I'll make a video answering your question. I don't always answer what you think you want to hear, but I am frank and I am honest and I am straightforward for my perception as an experienced hypnotist who's been doing this stuff for a long time. Thursdays is trance time. I actually guide you through a trance experience. And of course, Tuesdays is news and rants. I rant sometimes. Now, once a month, we do have webinars. That's a web-based seminar on all sorts of things. If you have topics you're interested in, let me know. Please remember to hit subscribe for our channel so you get notices when we have new videos, so you can keep abreast of what's going on and what's happening and what's new out there. Please do like the video, subscribe to the videos, comment, let us know what you like about the videos and what you would like to see more of. Until next time though, this is Dr. Brian David Phillips saying, live trance and prosper. Bye-bye.